think anyone else has asked questions yet. So yeah, we've had a lot of people join us. So I'll maybe just do another. So I'm Dr. Emily Sullivan talking about breastfeeding. Was here a couple weeks ago, and we got lots of questions, including some about just things I talked about before, but they're really popular topics. So I'm going through the questions, and then going to talk about some common issues and topics too. If you have any questions, feel free to comment, and then I'll try to answer them as best I can. So yeah, back to the questions. Someone asked about whether thrush could decrease supply. It definitely can for a number of reasons, like breast or nipple pain from the thrush. If baby gets thrush in their mouth and then they don't want to nurse, it's kind of like, it's hard to say without knowing the full picture and without assessing for the thrush myself. So definitely, if you feel like you're having thrush, please come see me and then we'll work through it, because yeah, there's a lot of factors that can go into it. So we have a question from Kelsey Kendall. What are some signs a breastfed baby may have an allergy to something in the mother's diet? So there are actually like very few indications that the mom needs to change something in their diet. And this is kind of a pet peeve that I have, because I feel like we already give breastfeeding mothers and all mothers such a hard time about do this, don't do that, this is best for your baby, this not, you need to cut this out, oh, your baby is looking fussy, you need to do this. So if your baby has a true cow's milk allergy, they will have like blood in their poops, and then you'll need to cut out all dairy. And cutting out all dairy is really hard. Like, it's not just not drinking milk or having yogurt and stuff, it's cutting it, like it's like reading bread labels at the grocery store and seeing if there's any dairy in that. So in general, if your baby has normal fussiness, even if you think they're kind of gassy, you don't need to cut out milk. If they have a cow's milk allergy, they'll like poop, there'll be blood in their poop. And then there's other, so that's not super common, but one of the more common things. And then there's other rare things like food protein induced enterocolitis, FPIES, where they can have like a severe vomiting type allergic reaction to an array of foods. But again, your baby would present like quite unwell, a lot of vomiting and diarrhea, generally like not growing and things like that. So in general, I mean, if you find that when you have a ton of coffee, your baby's fussy or whatever, tweak your diet a bit like that, but please don't drive yourself crazy making a whole bunch of changes to your diet. And yeah, if your baby is truly, if you are truly worried about your baby, or if your baby's having blood in their stool or losing weight, not gaining weight well, your baby is like truly crying nonstop all the time, definitely see your doctor and make sure there's not a medical condition that you might need to make changes to your diet for. But yeah, in general, you can eat most things. And it's been shown that, a very dieted mom actually helps babies when they're learning to eat, because they have, they haven't been eating something that's the exact same every day. There are slight changes to the taste. So yeah, it's good to have a varied diet. Good question. So another question was, how much formula my baby should be having if they're getting some breast milk. I'm really sorry, but I just feel like I can't answer this without knowing baby's nursing schedule, baby's weight gain, the amount of solid food intake, mom's breast milk supply. So again, like this is something that I see a lot in my clinic, and I'm definitely happy to see this or any questions like this in my clinic. You can either phone and book yourself at Cornerstone Medical Clinic, or you can get your family doctor or lactation consultant or midwife or whoever to obstetrician to refer you, either or. So a lot of questions about supply, which we talked about last time, but I think it's good to go over because it's just really common questions. And again, keep sending me any other questions you have. So there was a question about, well, I guess first we'll talk about just like general good ways to increase supply. The best way is to offer your baby the breast as much as possible, especially in the early days. The more that you nurse in those first, few days, week or two postpartum, the more it tells your breast that like we need to make a ton of milk. We have a baby here. So like letting them cluster feed as much as you're able to. I know it can be so hard and you're like sitting there at hour 5 and it's like 2 a.m. and your nipples are just like, why? But as much as you can tolerate, letting them cluster feed in those early days is really gonna increase your supply long term. So both suckling at the breast and milk removal increase supply, so that's why you can also pump to increase supply. Best way with the pump is doing a double pump, so pumping both at the same time. Double electric pump in studies has been shown to give the most milk, and then doing hands-on pumping, so like hand expressing while you are pumping is going to increase your output and increase your supply the most as well. And unfortunately, prolactin, so our hormone that tells our breast to make milk, our levels are highest between like midnight and 5 a.m., which is really sad because that's when we want to be sleeping, but that's when that hormone is highest. So any breastfeeding or pumping that we do during that time is going to have the greatest effect on increasing our supply. Other things, so if your baby's getting a bottle, just making sure that you pump every time the baby gets a bottle. So baby's demand always matches your supply. And then just general things like staying really well hydrated, getting enough calories. I often like prescribe ice cream to moms because you just like, you need the hydration and the calories, no matter how much you nurse or pump or take medications. Just baseline staying hydrated and getting calories is important, and it's so hard because you're nursing and changing, and sometimes you have other kids and you're doing everything for everyone else, but really try to remember to keep yourself fed and watered. And then so other things to increase supply, there's herbal medications like blessed thistle, fenugreek. You generally have to take a lot of them, and I usually tell my mom, so like this is how much the prescription medication can increase your supply. Usually the herbs are kind of more like here, so you definitely can see some increase, but not as much. So a medication that I very commonly prescribe and is very safe is domperidone. And you can go up to like pretty high doses of that, and many women will notice an increase in their supply with that. Also, so in women that there's kind of new studies coming out around this, so it's probably something that maybe we'll see a bit more about, but we're starting to do. In women who have like thyroid disease or diabetes, obesity, PCOS, fertility problems, and we don't know exactly how it works, but all of these women kind of with problems on that spectrum might actually respond to a different medication than domperidone, a medication called metformin. So again, if you feel like you are having any supply problems, if you are pregnant and have those issues, then I'm happy to see you, and then we can kind of troubleshoot things and see if you would be a candidate for a different medication too. And of course, especially early days, if you are having supply problems, you should see either your family doctor or obstetrician or me to make sure that you don't have retained placenta that can stop your milk from coming in, or if you had a big bleed postpartum or anything like that and you're anemic, your blood levels are really low, that'll affect supply too. So another common question last time and this time was, when is a good time to pump and store milk? So this can be kind of risky in the early days when you don't really know how much baby is needing. You generally, like especially in the first few weeks, unless you have like a significant oversupply, you would want to just let baby take what they need. But you know, once your baby's older, and especially if they've kind of have a routine or like semi-schedule, and you know when they are likely to eat, you can, you know, pump between feeds. It's generally always safe to pump after a feed if you're wanting to store that milk or whatever, but you usually won't get too much as long as your baby's an efficient feeder, which you would hope they would be. So another thing that's nice to use is called the Hawka. And you can get that at Cravings now too. So it's just kind of a suction. You put that on the opposite breast when you're breastfeeding. Can be great because then you don't have to like wash all your pump parts and everything. But same thing, you would just want to make sure that your baby doesn't need that milk. So like if you know your baby always takes one breast and that's it, that would be a great time to use the Hawka. If your baby generally takes both though, then you wouldn't want to take that milk off, and then baby is left with like half a breast worth of breast milk or anything like that. So another thing, in general, for like almost all women, we have a lot of milk in the morning, so like really high volumes of milk in the morning, and it's like thirst quenching, generally like lower fat, feeling engorged in the morning. That can be a good time to pump because you have a lot of extra milk. And then throughout the day, totally normal, your volume of breast milk decreases, but the fat and the calories increase a ton. So you generally won't feel like you have extra to pump later in the day, but it's totally normal, and it's fine for your baby to just get that reduced volume of milk in the evenings because it's so high in calories and high in fat. That can kind of be a difficult time too for parents because they feel like it's the evening, my breasts feel empty, baby's not getting anything, but just remember, usually they are getting like that good fat, like high fat milk at the end of the day.